And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And we've heard so much about aspirin in the past, so is it a good thing to take aspirin or a bad thing, as the segment indicated?
Well, as we talk about all the time on this show, anytime you take a medication, there's always a potential risk, and this study is just highlighting potentially a risk of taking the aspirin. We've really known about this risk ever since we've been prescribing aspirin, that some patients will bleed, unfortunately, but it is in the interest of reducing the possibility of having a cardiovascular event, which is a stroke or heart attack. Personally, for me, the more risk factors you have, the more likely I'm going to put you on an aspirin, because I see more issues with the cardiovascular events versus the bleeding, and that's really how medicine it works out there in the real world, in the trenches. It's an art. We base our decisions on the studies as well as what happens with our patients. So even though the study came out, if I'm seeing a high proportion of my patients coming in with strokes and heart attacks, I'm more than likely going to put them on an aspirin. Yes, there's always a potential for the risk, and I'll have that discussion with the patient such that if it does occur, we're all aware and there is no issue with they didn't know. And a lot of times these bleeding issues can be resolved just by stopping the aspirin, giving some blood transfusions and doing evaluation. Not to make light of bleeding.
Right.
I'm just saying that most patients tend to not tolerate the stroke or the heart attack as well as if they bleed. We have this whole other issue with these other blood thinners like Eliquis and Pradaxa, which are on the level of Coumadin that we have the same conversation with all the time. Medicine is a risky business. It's never going to change, and we just have to have that discussion with the patient, making sure they understand and making sure that the benefit of the medicine typically outweighs the risk of the medicine.
And taking aspirin just on your own, not a good idea. You need to be under a doctor's care.
I think long-term, no, just because it is a powerful anti-inflammatory. It is a powerful blood thinner. So I think if you have some aches and pains and you want to take a few aspirin a few days, I don't think that's a huge issue, but certainly the more medical problems you have, the longer you take it, then yes, your doctor needs to know about it because of these risks that we mentioned. Just because it's over the counter doesn't mean it's safe.
Okay.
Tylenol is the same way. Sometimes you can mix Tylenol with alcohol and have severe liver injury. So you have to certainly be aware of that and communicate with your primary care physician or healthcare professional if you are taking medicine on a regular basis, whether it be herbs or any of those other over-the-counter products as well.
All right, on to some of our viewers' medical questions. This person wants to know, how can you cleanse your gallbladder of sludge naturally?
Really not sure. It's not something that we normally have to do. Sludge comes up a lot of times when we're working up abdominal pain. We do ultrasounds of the gallbladder. They see sludge. It's abnormal. People don't like that. They want it clean. It's like wax in your ear. How do I get this, sludge out of my gallbladder? But we don't have to remove it. It's benign. It's non-cancerous. It can stay there.
Back to some of our viewers' medical questions. This person wants to know, how can a person with bad inflammation and arthritis show negative for those things in blood work? I have it pretty severe, and blood work said it's negative.
There's a small portion of patients who have what we call seronegative arthritis, meaning the blood work is flat, it is benign. It really takes an expert to figure that out. So rheumatologists are kind of the arthritis experts. So it would be that rheumatologist that would say, I think you have an arthritis issue, your blood work is flat. We're still going to treat you with anti-inflammatories or what other medications they deem necessary. They might need a second opinion from a rheumatologist. These diseases are very difficult to diagnose and treat, so a second opinion might be in order, but we do see it. It's just on a more rare issue, maybe less than a third.
Okay. Another person, my 2-year-old daughter gets red splotches around her mouth. We don't know if it's from dairy products, but she can also eat hot sauce, and she gets these red splotches. What do you think it is?
It could be anything, anything our mouth comes in contact with, whether it be a liquid or a solid. It could be hot sauce, it could be milk. Certainly can cause an inflammatory condition. Avoidance behavior is what we recommend, certainly 2 or 3 week trial to see if the lesions went away. We were just talking about the rheumatological illnesses. Autoimmune illnesses certainly can cause red splotches in the mouth, so certainly would be concerned about that. Fungal infections, viral infections, so a lot of times a trip to the dentist office or ear, nose, and throat doctor, maybe a biopsy, might be in order to make that proper diagnosis.
Since it's around the mouth, is there a topical that you could put on it?
We always start out with topical steroids because redness, inflammation, that's what that means. Steroids is kind of the go-to medication. So yeah, a medium potency steroid cream normally is what we start off with. Long-term use is frowned upon because it can start changing the skin around it. And again, you just need a diagnosis. You don't want to keep putting a Band-Aid on something that deserves different treatment.
Right. This person, can arthritis make your arms feel like the muscles are sore and cause pain in the bones?
Typically, maybe some referred pain. Arthritis certainly has joint inflammation, so predominantly the joint will be inflamed. That will be the biggest complaint. My joint is stiff, it hurts, it's swollen. Maybe in the surrounding joint you can have some soft tissue pain because of the inflammation, but certainly if it's your muscles, or what we call soft tissue, that's probably a different illness altogether. Maybe muscles are inflamed, maybe a side effect of medication. Those conditions can coexist, okay? Lupus can do that. That's one of the premier issues that we see. Oral lesions, as we mentioned, so a good proper diagnosis is probably in this person's best interest.
All right. Unfortunately, we're out of time. We appreciate you being here and
right.
answering all these questions. And of course, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.